Hello everyone, welcome back to Sowkya Vision. Today we are going to discuss scalp. What is scalp? Scalp is a soft tissue that covers vault of the skull. Yes, scalp is a soft tissue that covers vault of skull. Now, it is not completely covering the skull. Yes, it is just covering just vault of the skull. What is wall? It is a cap. Yes. Now, from where it is extended? It is extended anteriorly to the superciliary arch, posteriorly superior nuchal line and laterally superior temporal line. See, the scalp is extended anteriorly till the superciliary arches. Yes, posteriorly it is extended, limited at superior nuchal line. We have transverse nuchal line, superior nuchal line and inferior nuchal line. But the posteriorly it is extended up to superior nuchal line. Yes, and laterally it is extended up to superior temporal line. There we have inferior temporal line also, but it is stopped at superior temporal line. Now let's see what are the layers of scalp. Scalp containing main 5 layers. What are they? Skin, connective tissue, aponeurosis, loose areolar tissue and pericranium. Yes, skin, connective tissue, aponeurosis, loose areolar tissue and pericranium. See, first of all, skin. We are going to start with the skin of scalp. The skin is very thick. The skin of scalp is very thick. The thick skin, yes, it containing hair. Yes, it containing hair except at forehead. The skin of scalp is thick, yes, and it is containing hair follicles. Yes, and is it containing hair follicles except at forehead. And this skin is firmly attached to dense. It is firmly attached to aponeurosis by a dense connective tissue. Yes, this is the skin. First layer is the skin and this is the aponeurosis. These two layers are connected by a connective tissue. Yes, these are connected by connective tissue. The first layer, that is skin of scalp containing hair follicles. If hair follicles are present, sebaceous and sweat glands are also obviously present. Yes, hair follicles, sebaceous and sweat glands are also present. Due to the presence of sebaceous gland, this area is prone for development of sebaceous cyst. Yes, for the development of temporary sebaceous cyst. Now, what is the second layer? The second layer is connective tissue. The second layer is connective tissue. The connective tissue is also known as what? Superficial fascia. The connective tissue is also known as superficial fascia, where it containing dense fibrous connective tissue. Yes, it is containing dense fibrous connective tissue. It is made of dense fibrous connective tissue. Binds to the skin of scalp to the aponeurosis. As I said, the skin and the aponeurosis are connected by the connective tissue, which is the second layer of the scalp. Yes, and this connective tissue is divided into many lobules by fibrous septa. Yes, it is divided into various lobules by fibrous septa. And this connective tissue, the layer, and there will be question like which layer of scalp containing blood vessels? That is connective tissue. The connective tissue is the layer of scalp that containing blood vessels and nerve fibers. And now the third layer of the scalp is what? Aponeurosis. Yes, aponeurosis. It is also known as Galea aponeurotica. It is also known as Galea aponeurotica or epicranial aponeurosis. From where it is forming aponeurosis? It is from a muscle known as occipitofrontalis. Yes, occipitofrontalis is a muscle that is extending from the occipit to frontal. Yes, now the occipit containing two bellies and frontal is containing two bellies. So, these two bellies are supplied by facial nerve, branches of facial nerve. Yes, occipital is supplied by post-auricular branch and frontalis is supplied by pre-auricular branch. Yes, now as I said, the aponeurosis and the skin, first layer and the third layer are connected by the second layer. Second layer containing blood vessels. Yes, aponeurosis is of occipitofrontalis muscle. Now, The fourth layer is what? Loose areolar tissue. Why it is called areolar? As it is containing alveolar tissue, we call it as loose areolar tissue. And it is transversed by emissary veins. Yes, this loose areolar tissue is transversed by emissary veins. What are the emissary veins? These are valveless veins. Normally, veins containing valves to obstruct what? Backflow. Yes, but here the emissary veins doesn't contain any vein, any valve. Yes, it doesn't contain any valve, but what is its main function? It connects, it carries, it communicates blood from the intracranium to the extracranium. What is extracranium? Outside the skull, right? What is outside skull layer? We are having blood vessels, that is connective tissue, that is second layer of the scalp. From second layer of scalp, these emissary veins carry blood to the intracranial venous sinus. Yes, intracranial dural venous sinus. Emissary veins, as I said, it is valveless veins, connecting veins in second layer with intracranial dural venous sinuses. What is second layer? The connective tissue. Yes, the connective tissue is the second layer of the scalp, right? Now, these emissary veins connecting second layer to the intracranial venous dural sinuses. Now, what is the fifth layer? Pericranium. Pericranium is what? Layer of the bones, right? As we know, the vault of bones made of many bones. The vault of skull made of bones, right? The bones containing periosteum, right? This periosteum is going to form the pericranium. Yes, this it is firmly attached to the sutural membranes. It is firmly attached to the sutural membranes. Now let's see in the diagram. As I said, it containing 5 layers. Let's appreciate them. First one is skin, second one is connective tissue, third one is aponeurosis, fourth one is loose areolar tissue, and the outermost is what? Pericranium. Innermost is what? Pericranium. As I said, the first layer is the skin containing follicle. These are the hair containing follicles, sweat glands, and sebaceous gland. Yes, the connective tissue, the connective tissue, dense fibrous connective tissue containing blood vessels. These are the blood vessels, veins, arteries, and the nerves. From second layer, these are the emissary veins. See, this is second layer, connective tissue. Emissary veins are starting from here and draining in intradural venous sinuses, intracranial dural venous sinuses. Yes, these are transversed through the third layer, that is aponeurosis. Aponeurosis is transversed by emissary veins, which are started at connective tissue. And fourth layer is what? Pericranium. Sorry, the fourth layer is what? Loose areolar tissue formed by alveolar cells, alveolar tissue. And the fifth layer is pericranium, which is formed by periosteum of bones of vault of skull. Yes, this is the scalp. Now let's see what is the nerve supply to the scalp. See, we have two components of branches. See, it is divided as pre-auricular and post-auricular. Pre-auricular means what? Before ear and behind the ear, front of ear and behind the ear. In front of ear we have 4 branches, and behind the ear also we are having 4 branches. The pre-auricular 4 branches are supratrochlear, supraorbital, auriculotemporal, and zygomaticotemporal. Yes, we know supratrochlear. Yes, and supraorbital, auriculotemporal, zygomaticotemporal. And posterior, post-auricular are 4. What are they? Greater auricular, lesser occipital, greater occipital, and third occipital. Easy to remember. Pre-auricular are 4, post-auricular are 4. Pre-auricular are supratrochlear, supraorbital, auriculotemporal, zygomaticotemporal. Supraorbital, supratrochlear, auriculotemporal, zygomaticotemporal. Easy. And post-auricular are greater auricular, greater occipital, lesser occipital, and third occipital. Yes, this is the complete discussion of scalp. If you have any doubt, please comment in the comment section. If you like the video, please do like, subscribe to the channel. Namaste.